Thank you all for joining us here for the 8th Annual Food is Medicine Symposium. My name is Katie Garfield. I'm from the Center for Health Law and Policy Innovation of Harvard Law School. We are co-hosting today's symposium with our friends at Community Servings. And in just a moment, I will turn things over to David Waters, CEO of Community Servings. But first, I'd like to just start as people continue to enter the webinar with a little bit of housekeeping. First, I would like to note that today we will be using the Q&A feature. So if you do have questions for our panelists, please submit them via the Q&A feature, and we will remind you of that throughout. And we will do our best to either respond directly to those where possible or to raise them with our panelists. Also, I know that a number of attendees have asked if a recording will be available for the webinar. We are recording today's webinar, and we will be making that recording available to all registrants after the webinar is complete, and likely sometime during next week. Additionally, if you encounter any technology issues, we would recommend that you email Kristen Sukis at our center. Her email is provided there. And then finally, I do want to note that this is the first in a series of 3 webinars, and that our second session has registration available on the Center for Health Law and Policy Innovations events page, and you can see a link there. We will also be providing links and descriptions for the additional webinars in the follow-up email that will be sent to all registrants after the webinar. So please do keep an eye out for that as well. This is really the kickoff to a really exciting series that we'll be having over the next 2 months. Again, if you have any questions, please don't hesitate to reach out to Kristen or to submit them through the Q&A feature. But otherwise, without further ado, I'm going to turn things over to David Waters.
Thank you, Katie, and good morning, everyone. Welcome to the 8th Annual Food is Medicine Symposium. As Katie said, I'm David Waters, the CEO of Community Servings. We are a medically tailored meal provider serving the state of Massachusetts. For the last 7 years, we've hosted the Food is Medicine Symposium with our partners and friends at the Center for Health Law and Policy Innovation of Harvard Law School in order to share the latest in innovation in the food is medicine space. We all know that unfortunately we can't meet in person, but there is an upside, and we're excited that the virtual format provides an opportunity to expand participation to areas all across the country. What's normally a 3-hour in-person event is now a 3-part webinar series, as Katie mentioned, with this morning's session being the first. Even though we can't see each other, we have a fantastic audience today with representation from Massachusetts and all across the country. I'm so glad to see in particular Representative Mindy Dahm and staff from Representative Liz Malia's office, 2 of our best champions in the Massachusetts state legislature, as well as our colleagues from around the country, from the Food is Medicine Coalition, healthcare providers and payers, and leaders from community-based food and nutrition programs. Thank you all for joining us. During today's session, we'll hear about the future of food is medicine at the federal level, while the next webinars focus on healthcare innovations in Mass Health, and then funder-driven expansion of food is medicine services and research. While these innovations could have occurred in any year, that they're occurring amongst a global pandemic and a quickly changing political landscape means that they take on a new sense of urgency and importance. I encourage you to register for the remaining sessions. The webinar on December 2nd will focus on Massachusetts Flexible Services Program in Mass Health and features a keynote by Mary Lou Sutters, Secretary of Health and Human Services for the Commonwealth of Massachusetts, as well as a panel discussion regarding Project Bread and Community Care Cooperative, or C3's Flexible Services Partnership. And on December 15th, we'll hear from funders in the food is medicine space, including leaders from the DentaQuest Partnership for Oral Health Advancement, the Food Initiative of the Rockefeller Foundation, and the Tufts Health Plan Foundation. Now, I'm delighted to introduce our speakers for today's webinar. Joining us today from Washington, D.C. is Chairman Jim McGovern. Chairman McGovern has been a member of Congress since 1997, where he represents Massachusetts' 2nd Congressional District and currently serves as the chair of the House Rules Committee. Community Serving's first got to know the chairman in 2012 when he was instrumental in introducing our medically tailored home delivered meals program to his critically ill constituents in Worcester. Since then, he has emerged as a tireless advocate for food as medicine in Congress, from co-sponsoring a congressional briefing on food as medicine in 2016 to forming the bipartisan food as medicine working group within the House Hunger Caucus. Chairman McGovern has been a longtime champion of our cause. We honored him at our 2017 symposium with the Food as Medicine Advocacy Champion Award. Most recently, Chairman McGovern and his colleagues on the Food as Medicine Working Group of the House Hunger Caucus introduced the Medically Tailored Meal Demonstration Pilot Act of 2020, as you'll hear about today. Joining Chairman McGovern in today's conversation is Vanessa Georges, a Community Serving's client. Vanessa was diagnosed with cancer in July 2018 and has been a client of Community Serving's for the past year. She was born and raised in Worcester, and although she's lived in other parts of the country, she moved back to Massachusetts for its healthcare and education systems. She's a single mother of a 20-year-old son who's at College of the Holy Cross in Worcester. And Vanessa is no stranger to the healthcare world, even before her diagnosis. She worked in healthcare software project management for 30 years. Lastly, I'm happy to introduce my colleague and friend, Robert Greenwald, who will be moderating today's session. Robert is a clinical professor of law and the faculty director of the Center for Health Law and Policy Innovation of Harvard Law School. In addition to teaching seminars in health and public health law and policy, for over 25 years, Robert has been engaged in state and national research, policy development, and advocacy to expand access to high-quality healthcare, reduce health disparities, and promote more equitable and effective healthcare systems. Robert is a longtime friend of Community Serving's and food as medicine organizations across the country. He is a co-author on the Massachusetts Food as Medicine State Plan and participates as a strategic partner to our National Food as Medicine Coalition. Robert, Vanessa, and Chairman McGovern, we're so grateful to have you join us today and share your experience and insights on how nutrition interventions such as medically tailored meals can help even more people across the country. Robert?
Good morning, everyone, and thank you for the introduction, David. It's truly a pleasure to have the opportunity to moderate this discussion with Congressman McGovern and Vanessa Georges on the future of food as medicine services. Before we jump into the panel discussion, I want to take a few minutes to briefly consider the broader context for this conversation. While there may be a vaccine in sight, we are still deep in the midst of the COVID-19 pandemic, and we continue to see the impact it is having on the need for basic services, as well as for a broad range of food and nutrition services. The COVID crisis has placed a financial strain on households across the nation, leading to rising rates of food insecurity. According to recent estimates from Feeding America, roughly 1 in 6 adults and 1 in 4 children will experience food insecurity in 2020. Here in Massachusetts, we've seen a 59% increase in food insecurity among adults and a 102% increase among children since the start of the pandemic. The crisis has also shown a harsh light on the impact that diet-related health conditions can have on overall health outcomes. Research has established that individuals living with diet-related disease experience far greater risk of poor health outcomes, including from COVID-19. And this has serious racial justice implications, with Black and Latinx being twice as likely to die from COVID-19 than white people, in part as a result of higher rates of diet-related health conditions. Now, we have been making progress in addressing the challenges and inequities created by this pandemic, particularly in our public health insurance systems. Both prior to the pandemic, but also in response to it, many states have expanded coverage of meals in their Medicaid community-based services programs. Some states have received approvals of waivers that expand the range of nutrition services available to Medicaid participants. and recent legislative and regulatory changes have provided Medicaid Advantage plans, increased flexibility to provide meals, food, and produce to individuals living with chronic illnesses. So there has been some progress, yet we are still nowhere near where we need to be in supporting sufficient access to food as medicine to all who need it. Let me end my comments on a positive note. As a country, we're in a moment of change. As I've described, emergency orders in response to the pandemic have allowed for the increased flexibility in both the Medicaid and Medicare programs for the provision of a broad range of food and nutrition services. This has created an advocacy opportunity for us to ensure that these new access points remain in place, providing food as medicine throughout the COVID-19 era and beyond. There shouldn't be turning back from increased access to food as medicine and other essential services. Also, we will have a new president and a new Congress in office in January. This too creates opportunities for us to advocate for an enhanced food as medicine policy platform that recognizes the critical role that essential services play in improving health outcomes, reducing health disparities, and reducing healthcare costs. With these challenges and opportunities in mind, let me now dive into the panel discussion. And I just have to say, we certainly have the right people here with us today to inform this discussion. So I'm going to start with you, Chairman McGovern. A question that I think is on everybody's mind. What issues do you think the incoming administration and Congress will be focusing on in 2021? And how does food and nutrition fit into those priorities?
Well, thank you. Let me begin by thanking David Waters and my friends at Community Servings and also the Center for Health Law and Policy Innovation at Harvard Law School for sponsoring this. And I'm honored to be on this panel with Vanessa and you, Robert, as well. Look, the focus of the new administration is going to, unfortunately, have to initially be on dealing with this pandemic and the virus that has infected millions and millions of people and caused an alarmingly high death rate in this country. And as it relates to some of the topics that we're talking about here, we need right now, and hopefully this will even happen before the new administration, we need to focus in on some sort of a stimulus package, some sort of relief package to help people get through this. And that includes implementing anti-hunger measures, which we've been pushing for several months now, including a boost to the maximum SNAP benefit by 15%, an increase to the monthly minimum SNAP benefit from $16 to $30, and a pause on all the harmful regulations that the Trump administration put into place that will throw people off of SNAP. But from there, I'd like to work with the new administration to expand SNAP eligibility for hot and prepared foods. I want to partner with restaurants and nonprofits to provide food for vulnerable populations. And we want to make it easier for SNAP recipients to do online shopping and or curbside pickup. I mean, we talk about food being medicine. If you can't get access to food, if you can't afford food, well, then we have a problem right off the bat. The pandemic, I think, is showing us the importance of being proactive rather than reactive with our country's social safety net programs. And I think if we had prioritized things like SNAP, unemployment, education, and healthcare earlier, I don't think we would be playing catch up right now. So I think we have to learn from kind of the mistakes of the past and try to prepare for whatever may come in the future. But initially, we need to respond now to the crisis that is very, very present. And you mentioned the alarmingly high number of people in Massachusetts who are food insecure. So that's what I expect would happen with the new Biden-Harris administration.
Well, let me just thank you for the priorities that you've just outlined and addressed, and that others in the House are certainly leading that are critically important to the people, certainly the Community Servings and others serve. Do you see a path forward in the near term, or do you think it's going to be a slog to get COVID relief legislation enacted?
Well, we'll get a pretty good indication next week whether there's any progress. Again, I mean, I don't want to wait 2 months before we get relief. People are hurting right now. And more people could fall into a vulnerable situation if they lose their jobs, or they can't afford childcare and can't go to work, go back to work. So I'm hoping that common sense and rationality will prevail, but that is not always a characteristic of Congress. So the good news is that Speaker Pelosi is talking to Senate Majority Leader McConnell. She's had ongoing conversations with Secretary Mnuchin. So my hope is that we can do something, but I hope we do something that addresses this issue, because the issue of food insecurity and hunger, it's just getting worse. It's getting worse. And let's all be honest here. This problem was a problem before the pandemic. It's just gotten worse with the pandemic. And I always tell people that hunger and food insecurity is a political condition, because we haven't had the political will to actually, find solutions. And one of the things that I'm going to be pressing a Biden-Harris administration to do, and I tried this with the Obama administration, and we had some success, but we didn't quite get where we wanted to go, is to establish a White House conference on food, nutrition, and hunger. Because to solve the problems we're talking about, it's not just one program here or one program there. I mean, we really need a holistic approach. And that includes getting the medical community at the table to not only appreciate that food is medicine, but to help make the case that preventative care includes good nutrition, and helping people recover from major surgeries in a way they don't re-enter the hospital requires access to good nutrition. That's what community servings does. And so those on the call, I would appreciate any help you could give me at the beginning of this new administration to get them to focus on this and make it a priority. Because, we just went through a whole presidential campaign and primary season. Does anyone remember any questions being asked about food insecurity and hunger, or food as medicine as a way to, to help keep people healthy and also save money? So we need to use our power to pressure the incoming administration to make this a priority.
Thank you. I would just add that I greatly appreciated the House's prioritization of increased support for the Medicaid program, because I also think that's integrally connected to our ability to provide food and nutrition services to many of our lowest income disinvested populations. So thank you for your leadership on that too. You've been an incredible champion, Chairman McGovern, of food as medicine in Congress for a long time. This past spring, you introduced a bill to create a pilot program for medically tailored meals in the Medicare program. Can you tell us a bit about the pilot program, what you're hoping to learn from it, and how you think it might impact the future role of food as medicine, medically tailored meals within our healthcare system?
Yes. Well, thank you for the question. Look, our healthcare system has many flaws. If we would design it from scratch, we would design it very differently. And even in terms of the focus of so much of the medical of our hospitals and our doctors, although that's now it's changing thanks to a lot of the research that you guys have been doing, and others, has not focused enough on the connection between food as medicine. Even people get medical degrees, there's not much of a focus in your medical education on nutrition. And yet we all know that food is medicine. My grandmother always used to say, an apple a day keeps the doctor away. It would annoy me. But you know what? I wish you were alive so I could tell you were right. I mean, it's common sense. But so much of what we do is reactive. We have more of a sick care system than a healthcare system. Sometimes it feels like that. So, working with some of the people on this call, at Harvard and community servings, we introduced the Medically Tailored Home Delivered Meals Act to formally evaluate the impact of medically tailored meals on healthcare use, outcomes, and costs for people who have diet-sensitive and chronic health conditions. This would help patients with things like congestive heart failure, diabetes, COPD, chronic kidney disease, and end-stage renal disease. It would also provide eligible patients with at least 2 medically tailored meals per day and access to one-on-one nutrition counseling or therapy, which is also very important because we want to have people, we want their habits in life to to reflect, what is in their best interest. And we're doing a pilot. I mean, I think we all know what this pilot program is going to show. I think it's going to show that, it helps people and it also helps control costs. But nonetheless, we have to do these studies. And my hope is that this pilot program will also show the Congressional Budget Office that there's savings here. That over a 10-year period of time, if we evaluate the costs and the savings, that this will actually save in terms of medical costs. And therefore, maybe we can get the Congressional Budget Office, when they evaluate the scores, how much these things will cost and how much we have to find offsets for, we'll realize that in the long run, we actually save money to the system. Keep patients well, but we save money. And one of the things about Congress, which is sometimes frustrating, is you have some people who really care about the well-being of individuals, and you have some people who only care about the bottom line. Well, we believe that medically tailored home delivered meals will satisfy both groups. One is we're doing something good for people, and two, we are actually saving money in the healthcare system and focusing more on preventative care and nutrition education and nutrition counseling, which we think in the long run, is a win-win-win for everybody. And so our hope is to try to get this thing up and going as soon as possible. And then as we get the data, to expand it nationally and to make this a staple of our healthcare policy.
Thank you very much, Chairman McGovern, for the legislation. And I agree that there's no reason we shouldn't expect that the results will be the same as they have for many other medically tailored meal programs that have been researched, that they do meet the triple aim of health reform, of improving health outcomes, increasing patient satisfaction with the healthcare system, and reducing cost. I mean, that is, as you say, a win-win-win. So really appreciate the role you're playing in helping to expand this in the Medicare program through Congress. Really incredibly appreciative of your work. I want to now turn to you, Vanessa, okay? Your experience as a client of community service is critical to helping us to understand the impact of medically tailored meals. So can you describe a little bit about your experience of receiving medically tailored meals from community servings? What impact has it had on you, your life, your home life, your family, etc.?
So I was in a position where I wasn't able to care for myself, cooking, cleaning. So these medically tailored meals pretty much were life-saving to me. I was malnourished. I kept having to go into the hospital for dehydration and different types of other issues. So these meals kind of empowered me to not give up, and they gave me hope. I felt that I was part of the community. It was one-on-one. They listened to my specific needs and dietary issues, and pretty much tailored these meals that have had an enormous impact on my health.
Thank you. Now, one of the things that's interesting to me about this is, as we talk to the payers, the insurers, sometimes they push back and they say, yeah, we're really supportive, but this should be a time-limited intervention. And I understand that there are some circumstance post an acute intervention, a person may only need to have medically tailored meals for a short period of time. But like any other health condition, sometimes there are medications or a service that people need to receive for an unlimited period of time. Can you talk a little bit about, how perhaps I think you've been on this program for about a year now, maybe a little longer. What's changed over time? Like at the beginning, it might have been around a particular stabilization. What additional benefits is it providing to you over time? What role does this program play for you?
So at the beginning, I was only able to swallow liquids due to the type of cancer I have. At the beginning of this, I was only able to, like I said, have liquid meals only. Over time, my dietary needs changed literally day by day. But more specifically is I was able to go from a liquid diet only to now I'm on a soft diet, which is fantastic. I mean, I never thought I would be there. So it's definitely improving my health. I know I'm able to call community servings if my dietary needs change or anything, medication changes or anything, and they're right there for me to support that and create a meal that's tailored to my needs.
Yeah, it's true. I mean, one of the incredible things about these programs, across the country, these food as medicine, medically tailored meals programs that people sometimes don't understand is how tailored they are to people's specific needs. Really healthy, nutritious foods that do meet individual specific healthcare needs, but also I have to say, community servings really focuses on taste as well. I mean, I was fortunate, my office was right next door to community servings for over 25 years, and it would always smell so delicious. And I was fortunate enough, every once in a while, David would invite me over for lunch or to try a meal. So one of the things that I experienced is this balance that they're working on to really make sure that it's tailored to individuals, super healthy, but also really meets particular needs, both in terms of the type of meals, but also just cultural tastes. Can you talk a little bit about how the meals have been adopted to meet your needs and how they do?
So, nutritionally, I've learned so much about the importance of vegetables, and they've introduced me to things like I never tasted quinoa. So they've introduced me to foods that I would never even go near or even think about eating, which I love now. And there's different kind of, like you said, culturally, they'll throw like, a different, like jambalaya, for example, as a meal. So it's great. I get to experience culturally and phenomenal, good tasting food.
I'm so glad that the program has been helpful to you. And we're going to come back to talk a little bit more about that. Let me just turn to you for a minute, Chairman McGovern. At our center, we work with community-based organizations, healthcare providers, researchers, and others who are interested in improving access to food as medicine. I know you also work with those same constituents. As to research, this past spring, the National Institutes of Health, one of the world's foremost medical research institutes or centers, released its 2020 to 2030 strategic plan for nutrition research. And the plan identified improving the use of food as medicine as a strategic goal. What an important gain. But how important is this research endeavor to your efforts? What do you see as the important questions that research needs to address to further support federal investments in the integration of food and nutrition services into our healthcare system?
Well, thank you for the question. And I want to give Francis Collins, the head of NIH, a great deal of credit for pushing this idea. And I want to thank many of the people on this call for helping to create the pressure to get NIH to focus in on the issue of food as medicine. But according to Project Bread, hunger in Massachusetts, as was mentioned earlier, skyrocketed since COVID-19. During the worst months of this crisis, 23% of Massachusetts households were food insecure. Food insecurity in Massachusetts has doubled because of COVID-19. Nationwide, the numbers are just as alarming. I mean, we're told that 50 million people are now food insecure or hungry. Now, without research, we wouldn't know the extent of the problem. Research also shows us patterns like the ones that we're seeing in our communities. The disparities in our healthcare are highlighted as a result of research. So it's the first step and a major step in helping policymakers understand that we have a crisis and that we need to take steps to resolve that crisis. And without research, we would not have bills like the medically tailored home delivered meals act. So research is really important. And it's a lot of what the research shows is, I think, what we all have always known instinctually, right? But nonetheless, you need the research, the scientific research, the solid research to be able to, again, hopefully persuade the Congressional Budget Office about the cost benefit of some of these things, but also to convince members of Congress who, quite frankly, a lot of people haven't thought a lot about this. I mean, I always tell people, and this comes as a shock to everybody on the call, but intelligence is not always a prerequisite for serving in Congress, right? So, I mean, we have to provide people with the tools to be able to make decisions and to be able to start prioritizing things. And so the research, not just that NIH will support, but the stuff at Harvard, the stuff at Tufts, the stuff that the community servings provides and Project Bread and our food banks provide is so incredibly important.
Yeah, thank you. It's really been heartening to see the body of research grow, particularly in the area of medically tailored meals. But we're getting there for produce prescription and for the whole broad continuum of food and nutrition services. Certainly, the body of research is growing, and it has made such a huge difference in terms of our ability to even work with and talk to the insurers. David and I from Community Servings often joke about how when we first started this work and we really tried to reach out with insurers, they were like, what are you talking about? Like, we'll never pay for food, or we don't even understand the connection between health and food. But now that they're starting to see the body of research that really shows what a difference it makes, really short-term, immediate impact on health outcomes. I'm very connected to Vanessa, what you were just describing. And then the impact that has on costs. And so now we're certainly seeing it, particularly on the public insurance side, Medicaid, Medicare, but even the private insurance side, getting more involved. And that's certainly about research. So the idea that the NIH is now getting involved and engaged in this can only be helpful to us. Because again, research takes a long time. It takes investment, but we're getting there. I think the body of research is far stronger than it has been in the past. So thank you for your role in that. I really appreciate that, of course. And then I just wanted to shift a little bit to the issue of healthcare provider education. And you had mentioned healthcare providers and their role earlier. We know that physicians and other healthcare providers can really play an important role in screening for nutrition issues and connecting patients to the services they need. However, many healthcare providers receive little nutrition education themselves. Can you talk a little bit about some of the work you're doing to highlight this issue and improve nutrition education in medical school curricula?
Yeah, and I had a conversation with a group of heads of various medical schools across the country trying to understand the disconnects, right? I mean, because it's, again, like, you're doctors, you should know the importance of nutrition to the health and well-being of your patients. And people responded by saying, well, we are required to teach so much that our curriculum is so overloaded that adding another thing is difficult. And then somebody said, and then on the medical boards, there aren't very many questions, if any questions on this. So maybe if we put some questions on the test, then they'll teach the test. But look, in the coming months, I'm going to introduce a bill that would push for medical nutrition for physicians in training. A lot of people, don't know that, as you just mentioned, that doctors receive little, sometimes to no nutrition education, which means that they're not equipped to offer the basic advice or the necessary referrals to their patients. And the resolution that I'm going to introduce at the beginning of the year calls upon the medical community to provide meaningful nutrition education, but it also urges our federal agencies, to make sure that federal funds go to academic programs that provide basic nutrition competencies, because I think that may be a little bit of a, carrot and stick type of approach to get them to do it. But again, with the research that is already out there, this needs to be a bigger focus of medical education. And again, I'm heartened by the fact that as I talk to more and more, hospitals and providers, there's a recognition that this is the direction we have to move in, and we just need to move quicker than the current pace that we're at. And I hope that we can help urge that along with this legislation.
Yeah, that just another really important piece of the puzzle to put together to maximize the potential benefit of food and nutrition services. Certainly, the providers play a critical role, again, in working with their patients and helping to identify the need and then make effective referrals. For those of you who haven't seen it, I just encourage you to go to our website, look for the Food as Medicine Massachusetts State Plan, really get a sense of how we're talking about these kinds of issues to maximize the potential of food as medicine here in Massachusetts. And this is being replicated, I just want to say, for my Food as Medicine Coalition partners across the country, all working on similar ways of really trying to expand the reach, not only stepping up during this COVID-19 pandemic, which of course people have in response to the dramatically increased need, but really trying to build this infrastructure of support for people. So greatly appreciated. So Vanessa, these are two questions, audience questions people are asking. One, can you briefly describe how you think medically tailored meals, so beyond your own personal experience, but based on your personal experience, you provide the best evidence. You can do all the kind of research, but you provide, can you talk a little bit about, so who are the people that you think could benefit the most from receiving medically tailored meals? Why do you think medically tailored meals in particular has been or is such an important intervention? Can you talk a little bit about that?
Yes. So people who suffer from chronic conditions, such as myself as cancer, enormously benefit from medically tailored meals. But like Chairman McGovern said, the education is not there with the providers. So unfortunately, the chronically ill patients, the illnesses just get worse and worse and worse. With my experience alone, I wasn't even able to get out of bed. I didn't have any strength. I couldn't eat. So these meals they start with prevention for malnutrition. They are a solution for malnutrition. And going forth, if we want to achieve these healthy outcomes, this is where it starts. From earliest childhood, we know that obesity is a huge problem. So education starts right from the beginning.
Yeah, I mean, you raise a very important point about malnutrition. I think there's increasing evidence that so often folks with serious chronic health conditions end up back in the hospital, not because of the underlying health condition, but truly because of malnutrition and dehydration, which folks that are dealing with serious and chronic illnesses are prone to. So many reasons why, for example, you were describing having a really difficult time eating. And now, I mean, you've been able to move on to soft foods and be exposed to foods that are really healthy to you. And so, what a challenge that is, of course, that hopefully we're making progress in addressing. Chairman McGovern, can I just turn to you for a minute? There are many questions coming in, but I just have one or two more. One of the things about food as medicine interventions, clearly play an important role in reducing health inequities, but are really just a part of the puzzle. And I just wanted to give you a minute because I know you work on so many important issues. Can you talk a little bit about the other kinds of issues that you see as really critical to improving the ability of our healthcare system to address the populations that have really experienced such disinvestment and as a result have such poorer health outcomes? Clearly, food and nutrition services a big part, but what are some of the other kinds of issues you are focusing on?
Well, look, COVID-19 did not create the racial disparities that we're seeing today. What it did was it magnified them in an unbelievable way. We have been negligent in terms of not addressing the issues of disparities in a whole range of areas. And similar to our criminal justice system, I mean, our healthcare system suffers from widespread implicit bias. The pandemic has taken a lot out of all of us. But now I think it is important now more than ever to address the social determinants of health. I mean, things like race, where somebody lives, their access to quality food. They live in a food desert. Healthcare, education, and economic stability has as much to do with someone's health as a doctor's visit. In many parts of the country, people from the Black and Latino communities are twice as likely to die from the COVID virus. Again, one of the reasons why I would like the White House to do this kind of big conference that covers a whole bunch of things is because I think the answer is to better health for all people in this country. Don't just fit into one narrow category. It's a whole range of things we have to look at. We have to have a more holistic discussion, and we have to have at the table not only the people who grow and produce our food, the medical profession, our schools. We also have to understand the importance of housing, and I mean, there are multiple things that we need to do, and maybe there is an opportunity. In the aftermath of this election to have that discussion. The problem in the past has been it's an uncomfortable discussion to have. And people find ways to avoid having it. And as a result, we don't do anything meaningful to change anything. I hope that we're at a moment where that is different. And again, we have a new administration coming in. We have new members of Congress. We don't know what the Senate's going to look like, but nonetheless, at the start of a new administration, this is the time for people to really weigh in and say, to help try to establish what the priorities are going to be for the next 2 years. And I hope that we will do that. I mean, I'm trying right now to figure out ways in the House, to get more of a focus on the issue of social determinants of health, because I think that it can't just be, one. It's not just about medically tailored meals. That's an important part of it. It's not just about increasing SNAP. That's an important part of it. But, where people live, the access to nutritious food, access to healthcare, all those things are important.
Many people have written questions in about the role of registered dietitians and nutritionists in this effort, and questions about the role that they play, also about coverage of services, so many questions. But let me first turn to you, Vanessa. Can you talk a little bit about, have you had the experience of working with a nutritionist, and talk a little bit about the role that they've been playing in terms of helping you?
So right from the start, the intake process of community servings is one point of it is, can you fill out your dietary needs, things I'm having problems with, what I can eat, what I can't eat. And a dedicated nutritionist goes over that intake form with me. So I understand better, what my options are or meals that are offered. And she understands my needs, which is the most important thing. If we're not communicating or understanding each other, then it's not going to work.
Yes, very important. Thank you. Congressman McGovern, we have so many offers here in the questions of basically along the line of, how can I help? So many people asking, how can I support your efforts? What role can registered dietitians and nutritionists help play in educating or informing members of Congress or helping to move this issue forward? So can you tell us a little bit about what works? How do people help to inform your work?
I've learned about much of what we're talking about here today because you and David and others have come to talk to me. Researchers at Tufts. So we've had, and Vanessa, thank you so much for your incredible insights. But, I've had constituents who have had similar issues to deal with, as Vanessa is talking about here today, who've come to talk to me. So, part of what I think people need to understand is that they have to assume the role as educators, Members of Congress do not know everything, even though they pretend to. They just don't. And so, set up a meeting with your representatives and your senators and or their staffs, and have these discussions. And we'll have numbers for these bills at the beginning of January. And we will get the information out to people, but advocate that they become co-sponsors of those bills. Email them, stay in touch with their staffs, invite them to on-site visits when it is safe to do so. So, I mean, I've been on visits with community servings as they've delivered meals, and it's really inspiring, but it helps me appreciate how important it is, because I've heard from those who benefit. So it's not just isn't that a nice idea? I mean, I've got constituents who tell me, just how vital it is for them to be able to stay at home. So all those things are incredibly important, but we have to affirmatively reach out to our elected officials, because they don't always reach out to you. I mean, that's just the way it is. And as I said at the beginning, I always believe that hunger is a political condition. These are all political conditions that all the stuff we're talking about here today, all the things that we need to fix. When I say that, I'm not saying this is a partisan issue. But I'm saying we need political pressure to get people to prioritize this. And I think that we can mobilize that kind of support and we can get things done. So, stay focused on what's happening in Congress, and then weigh in, whether you favor something or you don't. And if you have any ideas, look, we're all open. I want to make this a priority, and I want this administration to make these issues a priority. And I'm hopeful. I'm hopeful in the aftermath of this election. I should also tell you I'm relieved, but I'm hopeful. I'm hopeful that we may have an opportunity to actually make some real progress, and that is good for everybody in this country, regardless of your politics.
Yeah, thank you. I really appreciate your comments. I think that, COVID-19, frankly, has created opportunities for us to really be able to connect with our elected officials in ways that we haven't. I mean, I was not a Zoom fan. I mean, how many times did I fly down to DC to have a conversation with you and folks on your team, and for us to organize a meeting that took us weeks to organize? And now we can communicate more easily, and it really is possible to reach out to your members and say, not just even to their staff, of course, critically important, but also to members. All I need is 15 minutes. Let's have a Zoom call. So I really do think that it's created opportunities that hopefully will make it much more possible for people. You don't have to go to DC anymore, really. You can really communicate with your members the way we're communicating.
Although I would say I prefer in person, but
I do too.
I just want to say one final thing here, and that is, I bump into people every day, and I'm sure you do too. Say, "Oh, I can't wait till we get back to normal." When do we get back to normal? Understand this: normal was not good enough. The disparities in healthcare, the disparities that have led to more communities of color being disproportionately impacted by this disease. They existed. They were there well before this pandemic. So as you said, this creates an opportunity because it's now right in our face. Let's not go back to normal. Let's do much better than normal.
Thank you. I have one more quick question for each of you, starting with you, Congressman McGovern. I would be remiss if I didn't follow up on this. One of the things you said is clear, and it's absolutely true. It's not one type of service, and it's also not one type of intervention. I mean, medically tailored meals, incredibly important, but so are produce prescriptions and other issues. And we are making a lot of progress on this idea of the important role that produce prescription can play in people's lives. Any likelihood you see the potential of a pilot produce prescription bill? And what do you think about the idea of really trying to drive that intervention as well? Again, it's not everybody needs the same thing, right? Some people truly need medically tailored meals. Other people have the capacity, right? Different capacities. And produce prescription seems to me to be one where the research is starting to grow and has real great potential. Can you talk a little bit about what you think about that issue?
So my colleague from Maine, Shelley Pingree, is very focused on that, and I'm supporting her 100% to see how we can get that going. Look, here's my parting thought here is that, look, the sky's the limit. You don't get what you don't ask for. And so ask for as much as you think is important to ask for here. And it is important that the medical community and those who have benefited, like Vanessa from some of these programs, continue to raise their voices and explain to people, the connections between nutrition and health and good outcomes. And also, the research will also show us how we save money. You improve patient care, the quality of life for patients. You also save money. So let's just do it. One of the problems, and this is not just in government, but it's also, in institutions like medical institutions. People have been operating under the same old assumptions forever. They've been doing things a certain way forever. And even when it's a good idea, that doesn't automatically mean people change. It's hard to get people to change, even when it's a good thing to change. We know, based on the research, we know based on the testimonies of people, that the stuff we're talking about here today is positive in every single way. So, we just need to bring it over the finish line. And I think we can do that. But it requires everybody, translating this conversation today into political action tomorrow. And I look forward to working with all of you, quite frankly, and continue to work with all of you, not only as allies, but you have taught me a great deal. Thank you, Vanessa. I've learned a lot from you today too, and I appreciate it. I'm going to repeat the things that you have said here today to others. But this is not a Democratic or Republican issue. This is an issue that should have appeal to both sides.
I think that's a great point, that this really is, food is medicine is a bipartisan issue. There's no reason that it needs to be anything but that.
In our working group in Congress that I co-chair, as Congressman Roger Marshall from Kansas, who's now Republican senator from
yes.
So now we have an ally that has gone to the United States Senate who happens to be a Republican. So we need to continue to build bridges with him and get him to advocate some of the things we're talking about here today.
I think that's right. Vanessa, I just want to give you the last question, which really is there anything more you want us, people, to know about food and nutrition programs? Anything you want to tell Congressman McGovern he should bring back to Congress? What else didn't I ask you?
I think people need to know that they have a voice. Like Chairman McGovern said, ask the questions. A lot of times communication is not there, so people don't know, what to ask, or they feel that their needs, won't be heard. So it's speak up, advocate for yourself. I know it is a hard thing to do for myself, but we have to be our own best advocates in order to achieve our healthy outcomes. We work together.
Thank you for that. I really appreciate what you just said, and I agree. I mean, I tried in the comments at the end to end on an optimistic note. I want to end on an optimistic note here too, to say there have been some really positive things. This flexibility that has been allowed in the Medicaid and Medicare program. We need to build off that, and we need to make sure that is not reversed, that stays again through the pandemic and moving forward. There is no reason why this expanded access to medically tailored meals, food as medicine writ large, should be reversed. We need the essential services to be maintained in these programs. And then finally, as Chairman McGovern said, we have a new administration. We have a new administration, a new president. We have a new Congress. There are real opportunities. But Vanessa, as you just said, it really is going to take us talking out loud, making really clear through advocacy the kinds of policies we want to see implemented, and what an amazing food as medicine law and policy platform could look like that really improves access. So I just want to thank you both so much. It has been a total pleasure to have this opportunity to have this conversation with you. And I'm now going to turn it back to David Waters to close it out. Thank you.
Wow, what a rich conversation, Robert. I feel so blessed to have both Chairman McGovern and Vanessa participating in the discussion. I feel like you've given us two very different, but also converging perspectives on food and nutrition programs for the individual, but also for our country's healthcare system at large. It's just awesome. I know for some of us who might not understand the intricacies of filing federal legislation, but it's abundantly clear how big an impact these innovative policies, such as the pilot legislation that you propose, Chairman, would have on the lives of our critically and chronically ill neighbors and family members. Hearing the direct impact of food as medicine services from Vanessa, I think really drives this point home. So thank you to Chairman McGovern for your consistent hard work in advancing food and health policies. And thank you to Robert for your really wonderful leadership and thoughtful questions. And particularly, I think it's really hard to speak up as an individual. So I have so much respect and gratitude to you, Vanessa, for taking the time, sharing your personal story, because everything that we all do on a policy or macro level is based on that individual. And it's just such an honor to serve people, I feel, and I know my staff feels this. So thank you, Vanessa. And thank you to everybody who joined us. It's just so exciting to see the engagement. And I've been looking at who's on the call and wondering how we might connect with each of you. I also want to remind everyone that there will be two more Food as Medicine Symposium webinar series programs on December 2nd and 15th. I particularly recommend the next one coming up on December 2nd because it takes these federal conversations and looks at them on the state level, where there are really innovative things coming from Mass Health and our partners at the state around the flexible services program. You will be so proud of what's happening here in Massachusetts. You can register for these from the CHILPI website, the Center for Health Law and Policy Innovation website. Just go to the events calendar, look for the webinars in the calendar, and you can register from there. I look forward to seeing all of you at future events. And again, my heartfelt gratitude to Robert, Chairman McGovern, and Vanessa Georges, and we'll see you next time. Thank you all very, very much. I look forward to seeing you.
Thanks, everybody.
Thank you, everybody.